Cancer doesn't always start with pain. Sometimes it starts quietly with whispers your body sends through small changes. But because life moves fast, most people miss those early warnings. And that's how something small grows into something serious. Awareness isn't about fear. It's about understanding your body before things get worse. In this video, we'll talk about 10 early signs of cancer you should never ignore, signs that could save your life or the life of someone you love. Before we begin, remember this. Not every symptom means cancer, but every symptom deserves attention. The goal is to be aware, not afraid. 1. Unexplained weight loss. Have you noticed your clothes suddenly feel loose, even though you haven't been dieting or exercising? Unexplained weight loss, especially more than 5 kilograms in a short time, can be one of the first signs of cancer. This happens because some cancers speed up your metabolism or interfere with the way your body absorbs nutrients. Cancers of the pancreas, stomach, lungs, or esophagus are known to cause this. Of course, weight loss can happen for other reasons like stress, diabetes, or thyroid problems, but if it's sudden and without reason, don't ignore it. Always talk to your doctor. Your body is your home. When it changes drastically, it's trying to tell you something. 2. Unusual fatigue. We all get tired, especially after long days. But cancer-related fatigue is not ordinary tiredness. It's a deep, persistent exhaustion that rest doesn't fix. This kind of fatigue happens because your body is working overtime, fighting against something it doesn't fully understand. Cancer cells consume a lot of your body's energy. Sometimes they even affect your red blood cells, leading to anemia, making you weak, pale, and drained. If you sleep well, eat right, yet still feel constantly exhausted, it's a red flag worth investigating. 3. Persistent pain. Pain is one of the body's loudest warning signals. But we often ignore it or cover it up with painkillers. Persistent pain that refuses to go away, even after rest or medication, deserves attention. For example, long-lasting back pain could indicate bone or ovarian cancer. Headaches that never ease might point to brain tumors. Stomach pain that lingers could be from pancreatic or liver cancer. Pain doesn't always mean cancer, but long-lasting pain with no clear reason should never be ignored. 4. Changes in the skin. Your skin is like a mirror, it reflects what's happening inside your body. Any new mole, lump, rash, or change in color could be a clue. Skin cancer, like melanoma, often begins as a small dark spot or mole that grows, changes shape, or bleeds. But other cancers can also cause skin changes, yellowing from liver problems, darkening around the eyes from fatigue, or itching caused by blood disorders. If you notice any new mark or mole that looks unusual, get it checked. Take a picture and compare after a few weeks. If it changes, see a doctor. Early skin checks save lives. 5. Lumps or swellings. A lump under your skin might feel harmless, but it can be one of the earliest signs of cancer. The most common are breast lumps in women and testicular lumps in men. But lumps can also appear in the neck, underarms, or groin, signs that your lymph nodes might be reacting to something abnormal. Run your hand gently over your body once in a while. Know what feels normal so you'll recognize when something feels different. The earlier a lump is discovered, the easier it is to treat. 6. Changes in bowel or bladder habits. Your bathroom habits can reveal more about your health than you might think. If you notice blood in your stool or urine, changes in stool color or texture, or if you find yourself constantly needing to urinate, it's time to pay attention. Colon, bladder, and prostate cancers often show up first through small urinary or digestive changes. You might think it's just something you ate or a simple infection, but when it keeps happening, get it checked. It's always better to know early than regret later. 7. Persistent cough or hoarseness. A cough that lasts for weeks, especially when you're not sick, shouldn't be ignored. It could be your lungs, throat, or even your thyroid trying to get your attention. Smokers often think it's just a smoker's cough, but persistent coughing or hoarseness can be an early sign of lung or throat cancer. If your voice changes, you find it hard to breathe, or you're coughing up blood, see a doctor immediately. Remember, early detection gives you the best chance of survival. 8. Unusual bleeding or discharge. Any kind of bleeding outside the normal cycle or area is a serious signal. For women, spotting between periods or after menopause could point to cervical or uterine cancer. For anyone, bleeding from the mouth, rectum, or unusual discharges from the nipple or private areas should never be taken lightly. Your body is designed to work in rhythm. When something breaks that rhythm, it's asking for attention. 9. Difficulty swallowing or constant indigestion. If swallowing feels like a struggle, or if you constantly feel food stuck in your chest or throat, it might be a warning sign. Esophageal or throat cancers often start with mild discomfort while swallowing and slowly worsen over time. Many people mistake it for heartburn or acid reflux. If you frequently take antacids but nothing changes, don't just mask the pain, investigate it. Early screening can make all the difference between recovery and regret. 10. Persistent fever or night sweats. A fever that keeps coming back without infection could signal something deeper, like blood cancer such as leukemia or lymphoma. Your immune system may be reacting to abnormal cells. If you often wake up drenched in sweat, or if you feel feverish and weak for no reason, don't dismiss it. Persistent fevers are one of the body's clearest cries for help. When to see a doctor. It's easy to brush off symptoms because life gets busy, but health should never be on hold. If you notice any 2 or more of these signs lasting more than 2 weeks, book a checkup. Doctors use screenings, scans, and simple blood tests to catch issues early, often before they spread. Remember, catching cancer early can make treatment faster, less painful, and more effective. Knowing the signs is half the battle, the other half is prevention. 1. Eat natural whole foods, more fruits, vegetables, and fiber. 2. Limit red meat, processed foods, and sugar. 3. Avoid smoking completely. Tobacco is the cause of at least 22% of cancer deaths worldwide. 4. Reduce alcohol intake. 5. Protect your skin from direct sun exposure. 6. Stay active. Even 30 minutes of walking a day strengthens your immune system. 7. Get enough rest. Your body heals while you sleep. 8. Go for regular medical checkups, especially after age 40. Cancer doesn't choose who to affect, but awareness gives you a choice, the choice to prevent, prepare, and protect. Every person who learns these signs becomes a light of hope for others. Your awareness can save a life, maybe even your own. Share this video with someone you care about. Don't wait until symptoms become too serious to act. And if you've ever known someone who fought cancer, honor them by helping others avoid the same pain. Here at Hope Against Cancer, we believe knowledge is power. And hope is healing. Subscribe for more life-changing health content. Together we can spread awareness, save lives, and replace fear with strength. Because in the fight against cancer, awareness is the greatest weapon of all. Hope Against Cancer, spreading knowledge, inspiring strength, and giving the world a reason to hope again.